Let's imagine a world where unseen threats could spark pandemics, and where communicable diseases beyond the COVID 19 pandemic can create a huge global health threat. Imagine a world where the probability of facing a pandemic similar to COVID 19 in your lifetime is nearly 40%. It's a world Bill Gates warned us about in 2015. A world where pandemics, deadlier and more relentless than ever before, loom on the horizon.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we've invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic.
But that's not all. Climate change, the invisible force shaping our world, is increasing the risk of even more frequent pandemics. Extreme epidemics might become 3 times more likely in the coming decades. But here's a catch. We have a chance to change this narrative. In this episode, we'll explore these two monumental challenges, their impacts on global citizens, contributing factors, concerns for the future, and how they're shaping the world. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health. From the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not necessarily represent any of the agencies or organizations we work for or are affiliated with.
Hi everyone, my name is Gordon, your host for this episode, along with my co-host LaShawn. LaShawn, let's talk about pandemics for a second.
Yeah, as we all know, we have been going through one, the COVID-19 pandemic, but generally speaking, pandemics are thought about as large-scale outbreaks of infectious diseases that, as we know, can greatly increase death and morbidity over a wide region that can cause significant economic, social, and political disruptions. I think we all, in one way or another, can relate to that, given that we've all been through one. But, Gordon, what are some of those highlights when we talk about these future pandemics that Bill Gates has told us about and that you were mentioning?
Yeah, there's a specific article, and we'll link all the resources in the show notes for everyone, but it talked about the risk of future pandemics and like the likelihood of those occurring once again and the security challenges that poses. And research estimates that we currently face a 2% chance of a COVID-19 like pandemic in a given year.
Wow.
In a given year. So
Wow.
in 2024, there's a 2% chance. In 2025, there's a 2% chance.
So putting those together, how does that look?
Bleak. It looks bleak. It looks bleak because we've been told, right? It's a cycle of 100 years. So there was a Spanish flu in 1918. And then people say, oh, yeah, we were due for one in 2020. But it's sounding like the percentages are off the charts now because of our current globalization and all the different factors that have changed. Pandemics are more likely to occur frequently than it did in the past. And that's something that demonstrates the value of preparedness and emergency planning more regularly and more robustly than we had in our human civilization.
But we know how it goes, especially in public health. After the pandemic, everything reverts back to normal and we stop caring about emergency preparedness and prevention.
Unfortunately.
Kind of sucks, isn't it?
That sucks. And that means that when we can't see something, the threat's removed, we stop caring about it, it doesn't get funded anymore. In 20 years, there's no more pandemic, and there's a meeting with all the decision makers, and they drill scientists, hey, but you said it was a 2% chance, and we've been throwing billions of dollars down the drain every year, preparing for a pandemic, nothing happened, and then we stop funding it, then the next year there's a pandemic. So it's hard to conceptualize what's the best way to fund preparedness strategies and to implement them and to have sustainable effort towards getting funding and keeping resources ready to be mobilized if that happened. But it just shows that I'm not that confident that we'll be in a better position than we were this time. Are you?
Yeah, I mean, I'd love to be optimistic on this one, but it literally, it's almost like one of those things where we hear about history repeating itself. And I
Mm,
feel like there's nothing that I can see, obviously, that would lead me to believe otherwise. But one would hope that we're learning from a lot of these lessons, especially when we talk about the stuff around vaccine equity and the
mm,
challenges and solutions for the distribution of these vaccines and treatments during any given pandemic. We really did a shitty job
mm.
during COVID 19 and currently
Yeah,
to distribute vaccines and do that in an equitable fashion.
right.
Have we learned?
I think we learn. I think it's just, you know what it is, LaShawn? The countries have their mandate. Their not loyalty might not be the right word. Their direct responsibility is always to the citizens of that particular country.
Hmm.
And high income countries will just always look out for their citizens first. So I
Hmm.
think they know it's the right thing to do to make sure everyone has vaccine access equitably. But in reality, it will never play out that way. It's
That's
sort
so
of the
sad.
you remember that movie Don't Look Up where the rich people got on the ship and when the planet was gonna be explode from the comet and
Mm.
the rich people got to leave and go to the
Mm.
other I
Yeah,
mean they that's a long story. But I think it's the same thing here where the more money you have, the more access you'll have to the technologies and different innovations first. And it's sad, but that's the reality.
so that's interesting because we know that this is likely to happen again.
Mm,
We know that the folks from high income countries will reap the benefits of putting money towards vaccine production and distribution and
right.
procurement of vaccines. When we're talking about global preparedness and we're talking about vaccine equity,
Mm,
we those are things we could plan for ahead of
right.
time.
Exactly. Exactly. One of the things that they were talking about, LaShawn, I think we've talked about this before, where one of the things they were trying to do, I can't remember what African country it was, but was to build the infrastructure there for them to
Yeah,
produce it
yeah,
so they can basically source it locally in that sense. And we know that cold chain supply chains and things like that are an issue. So then it becomes a matter of that intellectual property component, which we
yeah,
discussed with
yeah,
Julie Anderson
yeah.
from CanWatch, and making sure that those policies, international governance policies, are enacted prior to the next pandemic, and making sure that each kind of continent has the infrastructure they need to produce and serve people living in those specific continents.
Absolutely.
Mm,
And especially in like a culturally appropriate way, right?
yeah, culture appropriate way, and especially when you look at the probability of experiencing a similar pandemic to COVID-19 in anyone's given lifetime is about 38%. So
Jeez.
it's a pretty. If you someone told me I had 38% of winning the lottery, I would probably feel very. What's the
You'd
word?
feel good about that.
I feel good about it, and I'd feel almost like it's a certainty at that point.
Yeah.
Like after a couple years, I'd probably win it.
So have we gone through ours since we've lived through this one? Is
I
it
hope so.
over for us?
I'm good. I don't need any more. I'm
Yeah.
good.
Yeah,
I'm
yeah.
good.
But when we do talk about things like pandemics,
Mm,
a lot of the thoughts that are emerging these days is this idea of One Health
mm,
and the One Health approach.
right.
So that just as a reminder is that interaction between human, animals, and environmental health. And taking that lens in terms of pandemic preparation and prevention. Gordon, gone are the days that I can just focus on us humans and preventing pandemics. Is that true? What's going on?
Yeah, it's weird, eh? Because I remember when I mean, you kind of had an inkling, right, that
Mm,
everything's connected. Like obviously, trees help produce oxygen that we breathe, and everything's important, and that's fine. And I started to learn more through my public health program and about One Health, that wow, you're actually encroaching these environments. You're disturbing the virosphere. So all these microbes that are dormant in the wilderness or in the middle of some jungle that no humans ever gone to. And we're doing all these deforestation stuff, forest fires, flooding, and now all this stuff's moving everywhere and someone eats an apple and I don't mean to trivialize it, but someone eats an apple, or poverty stricken areas, they're eating animals that they never eaten before, or they're interacting more based on
Hmm.
people being forced outside where they typically would reside into more deeper parts in forestation for political reasons or any kind of other reasons. And then because of globalization, then that person in some remote area in this part of this country can eventually become patient zero for someone in Canada
Yeah.
who ultimately gets sick and spreads it everywhere. So it just goes to show that wide web of One Health, where the the forest, the trees, the animals, even the microorganisms as well can all, depending on the social pressures and environmental pressures, interact more than they should, and that
Right.
might cause more new and emerging diseases. But the story doesn't end there. In the tapestry of communicable diseases, we're finding heroes battling relentless foes. HIV/AIDS, malaria, and a myriad of other diseases threaten millions worldwide.
In Africa, at present, the three most pressing diseases that have the potential to roll back hard-won development gains are HIV/AIDS, tuberculosis, and malaria. Africa remains particularly hard hit. These diseases are not unknown in other places around the world, but today African countries are grappling with HIV/AIDS, tuberculosis, and malaria. 70% of all HIV positive people live in sub-Saharan Africa. 29% of global TB cases are found in Africa as well. And the number one killer of pregnant women and children under the age of 5 in Africa is malaria.
Yet, amidst these challenges, we discover the stories of hope. Stories of communities uniting against vaccine hesitancy, employing ingenious strategies for vector control, and championing immunization programs that save lives. So, LaShawn, we're talking about communicable diseases here, and typically people will think more about the COVID
Hmm.
19s, the flu viruses, and things like that. But there are other communicable diseases or that are infectious in nature that we should also be worried about.
Yeah, of course. So, communicable diseases we know can disproportionately impact resource constrained communities for a variety of reasons. And they're linked and overlap with determinants of health, whether
Mm,
we're talking about the availability of food, safe drinking water, basic sanitation, housing conditions, climate change risks, gender inequity, and these social cultural factors, as well as poverty,
mm,
right? So there's so many different interactions with communicable diseases when you're thinking about it from this more holistic lens beyond
mm.
that medical model, right? But what are some of these key aspects that we need to consider?
Yeah, so I did touch on HIV/AIDS, malaria, and there's also tuberculosis, which is this disease that's been around for so long.
Ancient disease.
Ancient disease, but it's not that ancient anymore. It's still around. I thought it was like long gone behind us, but it still affects many different communities. And I know I can't remember which expert in global health kind of talked about the four legs of the
Peter
table. Do you want to talk about
Hotez.
that?
Yeah,
Oh, Peter
Peter
Hotez. He was the
Hotez.
one that coined that?
Yeah, I'm pretty sure.
Okay.
Yeah, so I mean, traditionally, when we talk about these big disease groups, we're talking about HIV/AIDS, malaria, and tuberculosis. But then again, that's kind of like a stool. Some stools have three legs, don't they, Gordon?
Yeah.
Okay. So
Yeah.
we're adding that fourth leg, which is neglected tropical diseases, which, as its name implies, is neglected in the sense that not a lot of people even know about these group
Mm,
of 20 disease and disease groups that affect millions upon millions of people worldwide,
mm.
right? So that's just kind of bringing those together in terms of in saying that there's huge impacts from these four groups.
Yeah, and based on what we found from the WHO, when we look specifically at the big three, the HIV, AIDS, tuberculosis, and malaria, that accounted for 6% of the total burden of disability adjusted life years. and 7% of deaths worldwide every year. When we're talking about 7, 8 billion people in the world, that's a lot
Mhm.
of people who are impacted by those diseases from a disability perspective, and
Mhm.
people that ultimately die from the disease.
Yeah, absolutely. And then again, when we talk about these communicable diseases, stuff that really comes up again is vaccine hesitancy.
Mm,
Vaccine hesitancy has led to so many outbreaks of diseases such as measles in various parts of the world, right? We
mm,
thought we got rid of measles and it comes back. It has such a big R naught value. So you could see if you're not protecting against these diseases, you can do a lot of spreading,
mm.
right? So really thinking about those social factors when we're talking about vaccine hesitancy, we're talking about culture, we're talking about community, we're talking about, just general fatigue,
Mm.
right? During COVID-19, we talked about booster shot 1, 2, 3, 4, and those initial shots.
Right.
Are people just over it? In
Yeah.
you know?
Yeah. Yeah. I hear you on that one. The interesting thing too, I talked about TB, tuberculosis.
Hmm.
Malaria is another interesting one because
Yeah.
if you live in an area where there's not sort of this infestation of mosquitoes,
Hmm.
you think, yeah, whatever, malaria, it's in the warmer places of the world, no, nothing to worry about, right? But climate change is increasing the zones in which mosquitoes can live, the mosquitoes that carry
Yeah.
malaria, Zika virus, chikungunya virus, all those different types of viruses,
Yeah.
and that might create different exposures in populations that have never been traditionally exposed to those types of diseases. So there you could see, not, we're talking about vaccines and things like that, but we can see an interaction between climate change and the
Hmm.
distribution of infectious diseases as well
Yeah.
in it.
Absolutely. Absolutely. And again, we know that changes in temperature affects the metabolic rate of certain mosquitoes and insects,
Mm.
right? So it increases their activity.
On the mosquito point, right?
Yeah.
There's so the climate change is a big issue that has to be addressed systematically across like all the countries,
Mm.
but it shows in the short term and for regions that are impacted by it now, the importance of things like vector controls, right?
Vector control.
Vector controls, the mosquito nets. I remember when I was in Jamaica, to be honest, I remember sleeping under my sheet.
Yeah.
And this is gonna sound, I'm not saying this to be funny, but sometimes it felt like someone was poking their finger at my sheet,
Oh.
and it was like mosquitoes. There's so
Oh.
many mosquitoes there,
Wow.
and they would go around the different. I think the government would go around and spray different communities with
Yeah.
that nasty stuff. That would be a very short term solution to like come back and reproduce. So there's many countries still struggling with it, and beyond the inconvenience of, oh, something bit me and they're like zzz in my ears and I don't like that, they can carry diseases, and that's probably the main reason why public health and global health are concerned about those.
Yeah. And I remember when I lived in Thailand for a while, I went to a remote community and they struggled with many challenges, including malaria and
Mm,
dengue. And we would sleep in
dengue.
tents indoors to make sure that we got rid of mosquitoes and we were prevented from being bitten, right? And beyond that, when we were in the community, a lot of the hospital initiatives take you out in vans and different trucks, and we go
Mm,
to different homes, and we were able to see some of the professionals smoke out different houses to get rid of a lot of these mosquitoes and other
right,
pathogens that would affect people, right, and
right,
cause
right.
these diseases. So there's a lot of control mechanisms that are available, and these are things that maybe here in Canada we don't struggle with a lot, but these are huge concerns for many parts of the world.
Yeah, and I think it is surprising, and I don't want to overemphasize statistics here, but in 2019, there's almost 500,000 people
Wow.
that died from malaria.
Wow. Wow.
right? Mostly young children in sub-Saharan Africa.
Mm-hmm.
That's a lot.
Yeah.
That's the size of some countries. That's the size of some cities.
Yeah.
And that's something that potentially is preventable, right? There are processes and research undergoing right now to develop therapeutics and vaccines. I think there is a vaccine trial for malaria, LaShawn, if I'm not mistaken.
Mm-hmm.
That would be groundbreaking if you think of the fact that, and this is why when we say vaccines work, this is what we're talking about.
Yeah.
We're talking about something that we've been struggling to address for decades. And then you have something that comes in like a vaccine where over 5 years, that 500,000 deaths now turns to 10,000.
Yeah.
When we say vaccine works, that's what we're talking about.
Yeah.
We're not talking about vaccines work in terms of there are no side effects or some people want it and some people don't want it. We're talking about in real world situations where there's no other option. It has a significant power to reduce deaths by exponential levels. And that's exactly what we're talking about here.
Yeah, and then you're getting at a lot of the immunization programs and the importance of those, right? And one thing I will say about this is there's immunization programs for many diseases like measles, polio, influenza, and it's important that there's an integrated approach when they have these vaccination campaigns or immunization programs. We can't just focus on one of these diseases and then expect everything to be okay, because a lot of times you can integrate these different campaigns and programs to make sure that you're having a more positive effect rather than using vertical programming, expanding that out, integrating different programming, giving information to people, and just making sure that you're doing the most with the resources you have.
In this episode, we discussed the threat of future pandemics and the concerns we have around the world of communicable diseases. In future episodes, we'll discuss a lot more salient topics in public health. For now, we just wanted to briefly satisfy your appetite. This was Gordon and LaShawn signing off until next time.
Peace.
Peace. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.